That are speaking out against healthcare overhaul. Michigan Congressman Dave Camp is leading the call for investigations. Congressman, good to have you. You might have heard Senate Minority Leader Mitch McConnell saying that he would even ratchet that up by saying you go that way, we'll start holding off on your appointments. How bad is this getting?
Well, I think it's getting bad. I mean, look, this actually reverses a Clinton administration policy that said it's actually seniors have a right to know how their benefits may be affected. And we really can't get any answers on why this went into place and why it applies only to this one health insurance provider, but not to AARP, which is advocating on behalf of the plan. Look, we know from the Congressional Budget Office seniors' benefits are going to get reduced under these proposals, and I think seniors have a right to know that. Why has this occurred? We haven't gotten the answers. I think we need to have a hearing on this in the Ways and Means Committee. I'm still waiting to get some.
How far does this go, though? I mean, obviously, I would have thought that once the CBO came out and said a lot of what, for example, Humana, the insurance company, was charging was in fact accurate, that those, at least in Medicare Advantage, would see their benefits cut as things stand now. Yet the witch hunt continues. Why didn't it slow down after that? Why didn't they cool it on this gag order stuff after that? Why not?
You know, I don't know. And not only have they applied it to one provider, every Medicare Advantage provider cannot communicate with their beneficiaries. So it's an across-the-board gag order, not just to this one company. And if you look at the letter they wrote, it was pretty benign. It was pretty direct. And as you said, CBO has backed this up. And now we've got the Senate saying all their appointments are going to be held up. I'd like to have a hearing because, look, we do have an oversight function of CMS. There's no full-time appointed director there. They've waited 8 months and left this spot unfilled. You know, frankly, we need to get to the bottom of why this happened, who really requested it, what emails, what letters went back and forth, and what was the thinking behind it. There also are Supreme Court decisions behind this that say, look, beneficiaries have a right to know. This kind of communication is constitutionally protected as well. So this sweeping, overbroad gag order really is inexplainable.
In the meantime, the whole healthcare reform effort stalls, which is probably an unintended, but in your case, desired consequence.
Well, not really. I mean, they're moving forward in the Senate, I mean, albeit haphazardly with 600 amendments. Yeah. That is moving ahead. They're churning through, but I think they're at a disadvantage there. They're not using legislative language. They're using summaries of their proposals, and so CBO can't score those. And unless you know the real value of these proposals, you can either find a huge cost or a lot of people not getting coverage. And so I think they are at a disadvantage not having the actual technical language in front of them, thereby not getting the real information on what this is going to mean to not only small businesses, individuals, seniors, and other people who are going to be affected by health care changes. Well,
I've got you, Congressman. Nancy Pelosi is not going to allow for a vote on this measure. It's a bipartisan measure, I believe, to allow 72 hours for folks like you and just average folks, average Americans, to read and study the bills that will ultimately come up for vote, including this one. What do you make of that?
Well, we need to know. I think one of the things you saw is they slammed the stimulus through. They slammed through the House, actually, the health care bill. They're taking more time in the Senate. But ultimately, these changes are going to come at the last minute. As you saw before the Senate started their work, you know, a manager's amendment comes in and it's completely different, and you have to go through that. So, look, we think people should have time to look at this, especially a bill as important as this one. But in the alternative, I'd like to see us just take some smaller, more common sense steps, not only steps that will help us get to our goal, but steps that can be implemented today. And there is broad agreement on pre-existing condition and some of these other items in there. But let's do something we can do now, not something that has to wait 4 years to become effective.
Congressman, thank you. We'll be watching.
Thanks a lot, Neil.
All right, well.